It's so nuanced for each individual too. I know, like with clients, it's what's your diet history,
Yeah.
what's your age, what's your activity level, like all these things.
You hit the nail on the head. Metabolism is very specific to each individual.
Welcome back to the Level Up Life, Muscle and Mindset Mastery. I'm your host, Adam. Got Waz here, riding shotgun. Thank you for tuning in. Thank you for everyone who starts the video and finishes it. We appreciate you the most. Today I got a special guest, Berard. Dr. Jeff Berard.
Jeff will do.
Jeff, welcome.
Thanks for having me.
So what got you into chiropractic?
You know, I thought I was going to go the route of orthopedics, and just my mindset was always more of a holistic type of, I was never into, taking medications if I didn't have to. I wasn't that type of person. I met someone who was in the field who had an amazing lifestyle and changed a lot of lives, and that was kind of the pivotal point that kind of steered me in that direction.
So I know my personal experience with chiropractic. I've had, the kind where I go in and get cracked, and then it's like boom, boom, boom.
Yeah.
And then I've went into your facility, and there's a stark difference to me from some of the other facilities that I've been to and people I've worked with, where you guys treat more than just, you guys don't just crack. It's, you take the entire soft tissue system into account.
Yeah. People use the term holistic real loosely, right?
Mm-hmm.
And holistic is holism, right? It's the whole body. So in chiropractic, all that means in this Latin is to practice with your hands. There's a lot of things you can do with your hands.
Mm-hmm.
Adjusting is a tool, but it's not the only tool. So yeah, we do that when it's needed, but we try to just be diversified and give the patients what they need, and not everyone needs the same thing.
Yeah. For all the heavy lifters out there, I know personally, I've had to go in and get, general maintenance work done,
Yeah.
like heavy back squats when I was doing those, the compression that put on my spine, just coming in and getting on traction.
Absolutely.
I was like, oh, now my back feels normal again.
Yeah. When you look at what developed the whole system I have is earlier in my career when, I worked with some professional sporting organizations, they had this healthcare system that I think should be afforded to everybody, right? You have this high-paid athlete that gets injured, and they have all these types of services at their disposal. They have a chiropractor, they have a physical therapist, they have an athletic trainer, they have an orthopedic surgeon, they have a massage therapist, all in the same facility, and they all get care by all of them. And that was kind of the conception of this whole concept that I have, is I think everyone should be afforded the same level of care as an elite athlete, because we're all athletes in one way or another, right? And it works well.
Yeah. So I want to get into metabolism.
Yeah, let's do it.
Most people, when they hear the word metabolism, they think calories, they think weight loss. So tell me, why would a chiropractor be talking about metabolism?
Yeah, so, I've been practicing for 26 years, and one of the things at this point in my career is driving me crazy is I don't like to settle for what is. And there's so many patients that I've seen. I've been in Michigan for about 13, 14 years, and I'm treating some of the same patients, which I'm grateful for. Mm-hmm. But a lot of those people would get exponentially better if they addressed another component. And when people hear metabolism, you're right. They think of weight loss, weight gain. But metabolism literally controls every single function in your body, right? It controls your blood pressure. It controls the way you think. It controls how you absorb nutrients. Inflammation, every single function. The most minute function from an action potential, when you get a stimulus, that creates this influx of ions in and out of the cells. That's the start of metabolism, and it's everything in your body is controlled by metabolism. So why would a chiropractor, you ask, address that. Obviously, it's how can I do more for my patients? And that's one aspect that I just really didn't have time to do in the past. Now that I have a great team and a team robust enough to do a lot of the heavy lifting, I can really focus on taking it to the next level. And that's what I'm doing. And frankly, anyone can do it. Mm-hmm. It's just having the knowledge of certainty. You know, there's so much minutia out there. You turn on the social media and everyone's an expert at something, and they might say, eat all protein, eat all carbs. There's so much.
It's so nuanced for each individual too. I know, like with clients, it's what's your diet history, you know?
Yeah.
What's your age? What's your activity level? Like all these things.
You hit the nail on the head. Metabolism is very specific to each individual. Mm-hmm. So just imagine this, right? Imagine, I think everybody, if they can wave a magic wand and they can turn into the person they want to turn into, everyone would wave that wand. Like nobody wants to feel like crap or not be the best version of themselves. I don't care where you are in life. Everybody wants that.
There's more meat on the bone. We could have more, right?
Yeah, but you can't. You can't have. You have to be able to know what you know and know what you don't know. So if I were to, if you can imagine, I could say, all right, Adam, I'm going to check your blood, and I'm going to check 36 markers in your blood. These 36 markers are very unique to you. We take that blood work, okay? We send it to a group of food engineers and scientists who genetically engineer a meal plan specifically designed for you. What medications are you on? Do you have depression? Do you have anxiety? Do you have weight gain? Do you have high cholesterol, hypertension? And they design a meal plan specifically to address those needs. This isn't a food against medicine type of plan. It's food is medicine type of plan.
Love that.
And that's what it's for. And here's the thing. It works 100% of the time. It will never fail you. Mm-hmm. Not saying it's easy, but you don't have to go buy expensive supplements. You don't have to go buy shakes, pills, potions, and climb up Mount Everest to cook a meal. Right? This is stuff you go buy at the grocery store. It tells you how much to eat, when to eat, what to eat. You might think broccoli's good for you, but it might be bad for Dave. Mm-hmm. His physiology might not agree with broccoli, so you take broccoli out of it, right? We really dial it in to what exactly your body needs to manifest a balanced metabolism. So what happens when you have a balanced metabolism? Controls blood pressure, cholesterol, weight gain. I have clients that the amount of weight they lose, and this is not a weight loss journey. Mm-hmm. It's a metabolism journey, but as a result, you're not storing excess energy, right? You're consuming what you use, and that's the way the body is designed to be.
Mm-hmm. I talk with clients all the time about adaptive thermogenesis, and just it's simple where they're under eating, not getting enough calories for their movement, and how the body will actually slow down and start preserving for essential functions like bone density is essential. Breathing takes calories. It's essential. Your heartbeat takes calories.
Your BMR.
Yeah, BMR. That's all your BMR. And that's one of the biggest struggles with. So just in general, a client comes in, and this goes for, some of our youngsters that want to put mass on. And on the other side of the spectrum, people who want to drop body weight, when we tell them like, hey, you're eating way too little to effectively lose weight. You're in what's called adaptive thermogenesis or metabolic adaptation. That's the struggle, to try and convince someone who wants to lose weight, you need to eat more. It's counterintuitive.
Yeah, it's funny you say that. I was just on a consulting call with the client, and she was concerned because she's eating so much. Mm-hmm. It's like, you got to realize you're under eating before, and this is part of the problem, right? We got to fuel your system to get it going.
Give it a little bit of time.
Give it some fuel, and things will happen. Yeah, absolutely.
And then that goes into like what you're saying, the quality we're putting in our body. I'm sure these meal plans are high quality nutrition and not a lot of what's available in our society today. Like, and I think that's the struggle for people is our society's fast paced, and how does an individual who gets up, gets their kids to school, has to go to work 9 to 5, come home, they got sports for their kids, they come home, they have to cook dinner, and by this time it's 9 o'clock. Sometimes it's easier for them, instead of starting to cook at 8, they just say, you know what, I'm exhausted from the day, let's stop and get McDonald's.
Yeah.
So it's part of the lifestyle is so fast paced that makes planning, you have to be really efficient, you know.
You do.
Free time is now meal planning.
But one of the things is once you give the body what it needs, you stop craving the things you want.
Mm-hmm.
And you have mental clarity, you have more energy, and just people don't realize that. The amount of people that I see that are just metabolically a mess, and most people are, with the hypertension, high cholesterol, high hip to waist ratio, lethargic, anxiety, that's metabolic syndrome at its finest. And if they just trust, it works every time. If they just trust the process, it's really simple. I mean, literally in 28 days, you can transform the way you feel. The reason why I got into this, by the way, was personal. Like I didn't sleep. I would stay up at night and ruminate about everything. I'd think about all my patients, the stuff I'm supposed to do, the stuff I shouldn't have done. Oh, I made a mistake on this patient. I really should have done this. And I'm 53. Now a big craze is HRT and all that. Do I need HRT? And then I went down this rabbit hole. I said, before I even were to consider any of that, it makes sense to balance my metabolism first and then see where I land. And what it did for me is flipping amazing. I mean, I slept like a bear. I have energy of a bull. I mean, I feel like I'm myself.
Mm-hmm.
And I don't have any need to chase those other things that are out there. But because there's quick solutions, there's short-term gain for long-term sacrifice. And unfortunately, our society wants that they want it now. They want that short-term gain, and let's worry about later. Well, that's just not me. And I think if most people were to take the time to focus on metabolism, understand metabolism, they're hooked.
Right.
And when your metabolism balanced, by the way, you don't crave the things that you crave.
Right.
I don't crave the crap I used to crave. Like I would have to, you guys know my wife. I mean, she's fit as a fiddle, and I'd have to stop home and swing into the gas station and grab myself a Nutty Buddy on the way home because I would crave it. I don't crave that stuff anymore. I just don't. Do I still eat some crap here and there? Of course, you got to live.
Right.
Yeah.
My go-to for crap is pizza.
Oh yeah, pizza's amazing.
Love pizza.
I feel like trash after I eat it now.
Oh yeah.
But
bloated.
I still have pizza, but I eat super clean 6 days a week, and then 1 day a week I'll commit gluttony.
Yep.
My metabolism can handle that.
Mm-hmm.
But people do that every day.
Yeah.
Oh yeah, every day, day after day.
Yeah. They do
I
it every day.
I spent years doing the 6-7 smaller meals, and I could get away with eating crap far more often. It came up actually just before I got out of the oil field during COVID, and some of the guys, I'm like, dude, I was teeny when I graduated. It's like I'd lose weight like crazy, and I did. I went from 225 down to 205 in 3 weeks when I quit doing the 6-7 meals a day. And it was 1 to 2. That panned back out. I balanced out about 214, but I looked like shit with just the lack of calories that I was getting in with working all day and everything else, so under eating that it was, I mean, any bit of muscle I had from here went here, here went here. And I mean, big old spare tire, and it did not take long at all.
Yeah, if I were to boil down one thing with metabolism, is to keep your insulin spikes reduced.
Mm-hmm.
So this was the whole craze with intermittent fasting, right? So when these people, we call them grazers, right? They'll just eat throughout. They don't eat a ton, but they'll eat throughout the day. their insulin is jumping up and down, and that's really where the disease process starts. So it's to have a consistent, insulin,
Yep.
right? I eat 3 meals a day, 5 hours apart. I don't snack in between.
My personal meal schedule that works best for me because of my work schedule, because everything else is, I actually eat, call it a brunch, like 10 o'clock, where I'm consuming roughly 1,700 calories in one sitting, but my next meal is until 6, 7 o'clock. So then I'm eating about the same. I eat 2 really large meals, but when I do that, I don't feel, it works really well for me. I don't feel bloated because by the time I get there, I'm super hungry. So I have to watch what I'm consuming, because if I eat, the high starches, your pastas, your breads, that type of stuff, then I can tell I get those blood sugar spikes right after I eat. I can feel it in my body. So when I eat more of a low carb meals and low carb diet overall, and the carbs that I am getting are fibrous, they're veggies, they're natural. Potatoes is my starch is my go-to. Typically I feel better. I don't feel.
So you guys are in the muscle business. Here's something that's one of my rules with balancing metabolism and is essential amino acids, right? Building blocks of muscle. They come from protein.
Right.
So one of my rules is for each meal, if you have 3 meals a day, for each meal, you should have a different protein, and you never mix proteins. And this is why. So an egg has a perfect score of 100. It has all the essential amino acids. So if you mix egg with, I don't know, say bacon, right? It's reasonable.
Say that. I need to hear it. Though.
It's reasonable. I love eggs and bacon. Your body will absorb the lesser amount. So you won't
Get the egg benefit.
So one of my rules is you eat a different protein with every meal and you don't mix proteins. So you get the full spectrum of amino acids to build muscle. Who does that? Right? But
I'm going to start, but I don't know how now. Thanks, Dick.
Well, so I'm just thinking, and if you ate it in order, like let's say a breakfast bowl, for instance, I have egg, bacon, cheese, all combined. So if I eat the egg first, like I separate the bowl, I just have a pile of cheese, a pile of bacon, and a pile of egg. If I eat it egg, then the bacon, does it have the same effect?
it has the same effect.
So I'm still mixing,
it has
proteins.
It's not following my rule.
Okay.
Here's another interesting factoid. If you have a plate of food, right? You got your protein, your carbs, your starch. You take a bite of protein first. When that hits your system, it secretes a hormone that suppresses your insulin. So for those weight gainers, you eat a protein first, a couple bites of protein, and it'll stimulate some hormones to suppress that insulin.
So I've also read that if you eat, so like I'm just thinking laying out steak, potato, and broccoli, right? Just thinking of a meal that I've eaten. I have my steak, I eat that first. So I'm consuming the protein. And I know from my research that if you eat the veggie before the carbohydrate, some of that lines the intestines to where now that starch is actually absorbed a little bit slower. So does that can you verify that?
I think you're correct. Yeah, I mean there's a lot of nuances with that, but yes, there is. Anything you put in your mouth is going to have a reaction, but putting protein in your mouth first is able to secrete that hormone that suppresses, so you don't have that big insulin spike that makes us feel like garbage.
And that's what leads to insulin resistance.
Yep.
Because you keep having these spikes over decades, your insulin becomes less effective, and now, your pancreas gets tired, so it's just kicking it out, kicking it out.
I mean, you can see, my goal is to get people to feel the best version of themselves and show them how easy it is and inexpensive, by the way. Right.
Yeah.
I mean, all you're buying is groceries,
Right.
but you're buying the right ones.
Yeah. And I mean, it's that fear, right? As you're speaking, and I'm like, all right, you know, how much I respect you and your knowledge, and you say that, and it's.
I mean, you guys.
As soon as you said mixed proteins, that's my head went. And I
We
knew
all
you were
do
going to
it.
say eggs and bacon. I'm like, because that's my go-to. I mean, I have 4, maybe sometimes 5 meals a day now, and I usually don't eat my breakfast until I'm done with all my morning clients. A lot of times around 11 o'clock, and it's eggs and bacon. And I mean, I go pretty hard on the eggs, but I'll have 2 or 3 slices of bacon.
Or 6 or 8.
No, I actually, I do hold down because I have it often. I mean, not 7 days a week, but usually at least 4. And I know that's not my smart move just in general. But hearing that, I mean, I'll probably go through this week and finish that pack of bacon. And then, you know, whether that's Thursday, Friday, I will heed your advice and do that and see that difference maker. But mentally, I mean, there is that fear thing. And, I mean, obviously I can live without bacon. I don't do it every day, but it's kind of one of them staples of like, man, I can't wait. I've been up for 6-7 hours at this point. I'm ready to mow down as soon as I get to the house. And no bacon today.
I mean, am I the only one that thinks that way? Like, if I were to give my body exactly what it needed, how good could I feel?
Right.
I mean, if you can just imagine what it, I mean, doesn't that sound amazing?
Oh yeah. I mean, that's why I'm going to do
A
it.
regular exercise. And here's the thing, when people, and you guys deal with this, you got people that have metabolic syndrome. You know, they always hurt. They're just difficult clients. Not difficult to deal with. They're just difficult because they don't progress at a rapid rate that they want to. But you know, if these people could just, if you could just transform the way they start to feel, you change the chemistry in their brain, it just works. It sounds like a pipe
snowballs.
dream, but man, it's such a short period of time. You know, imagine getting all the right oils to fuel your brain. Hydration. Who hydrates enough? Hardly anyone.
Oh,
Good.
Him, regularly.
Yeah, without a doubt.
I struggle with that, you know, just because of my job, and I carry around my big water bottle. But, you know, sometimes I go at the end of the day, I'm like, my God, I haven't had any water.
See, I used to be the carry a gallon jug around, and I would be a gallon, maybe just over. I didn't have it. These wide neck bottles.
Yeah.
I'm getting, on a slow day, it's maybe just under 2 gallons of water.
Mm-hmm.
Just slamming it. I have usually a gallon in before most people are starting their workday.
Yeah.
And
8 miles.
almost a pot of coffee.
But, you know, when you think about all the minutia out there, and there's a lot, some of it good, some of it not. You know, there's now with, you know, there's a lot of weight loss stuff out there with injections, and, you know, God bless those people that go down that journey. They, you know, we can all live their own life. But, you know, if you have the knowledge to attempt to give your body what it needs, what you get out of it is just crazy. And but what my point was, I lost my train of thought for a second. My point was, if you go through and you give those essential nutrients that you nourish your body, right? We can all agree that for years we've known that with 100% certainty. There's no ambiguity to that. We know it works, but people still are out in left field trying all these other things when this is the thing that works every time. It will never fail you. And it's the cheapest. But why do people, it just amazes me.
It's a lot of work.
It's a lot of work, but it's not as much work that you put yourself through for your lifetime.
And not when you see them benefits.
Right. And that's,
like he says, give it 28 days. You know, making them changes, how that works, and he says it clears their brain, right? And how our thinking now changes. It's not work. It's not a pain in the ass.
Right.
It's fear, right? People
It's the
that
snowball.
I don't want to not do this, right? I think I need to have my McDonald's twice a day or however many
my
times a week.
Starbucks coffee every morning.
All that type of stuff. It's the fear. It's the convenience. It's wanting that easy button. Why would I work hard when I can go get this shot? Now it makes me not as hungry.
I always loved the saying, you suffer the pain of sacrifice now, or you suffer the pain of regret later.
Yeah.
Either way, you're going to suffer.
Right.
You know? But that just amazes me with what we know works 100% of the time without fail for everyone.
Yep.
Why do we go to everything other than that? Don't know.
Yeah, I was thinking of this analogy, and I say this to clients all the time, is think of your car and your body as the same thing. They're both a vehicle. So if you go to the gas station and there's two gas stations side by side, here you got guaranteed quality fuel, which is what we're talking about, is fueling our bodies with purpose and eating good, right? Something that's going to fuel us. And then you have discounted gasoline over here that's, you know, maybe $1 a gallon. You're saving like $3, whatever it is.
Yeah.
Are you going to go here and fuel your car to try and save that $3 knowing that it's probably going to damage your vehicle? Most people won't want that because they don't want to invest in the repairs. But the thing is, you can get a new vehicle. You can't get a new body. So when I just think of it like, I got to take care of the one I have, right?
I use that analogy all the time. You know, people come in and whatever care I'm offering, and if they don't have insurance, how much does it cost? And I tell them, not many in this community, you know, most people don't have a problem, you know, paying for their care. But, you know, when I practice in the Miami area, people would go spend $2,000 on their vehicle. But, you know, to get them to spend a couple $100 on themselves, they just wouldn't do it. You know, They'd say you can't afford it. I'm like, how can you not afford it? You'll put that money in your car, but you won't do it for yourself. But yeah, I don't know. The conundrums of life.
Yeah. Now let's take a moment to thank our sponsors, Pine Haven Assisted Living. At Pine Haven Assisted Living, they believe in making every resident feel at home. Nestled in the peaceful countryside of Hemlock, Michigan, they offer compassionate care in a family-like environment where residents can enjoy independence with the support they need. Registered nurse-owned and operated, their team provides personalized care, home-cooked meals, and a range of activities to ensure your loved ones continue to live a fulfilling life. They also have alpacas and llamas on site to enrich the lives of their residents. Experience the warmth and comfort of Pine Haven. Call them today at 989-295-6632. That's 989-295-6632. Or you can visit them on their website at pinehavenassistedliving.com. That's pinehavenassistedliving.com for more information. Now, back to the Level Up Life. So, from your side, how often do you see people whose pain and tightness isn't just structural, but it's something tied to the overall function of their body, say their metabolism?
Almost always, you know, with exception of acute injuries, really almost all of them, you know, whether it's sedentary lifestyle, that's the big one, right? Their muscles aren't moving, so their metabolism's sluggish.
Jobs.
Yeah, desk jobs. Yeah, almost always. I mean, not just metabolism, but you know, their physicality, their ability to sleep. It's a holistic approach. Almost everyone that has chronic issues, it's not just a skeletal issue or a muscle issue. It's the whole thing. And again, I don't like, a lot of people use like wellness centers and holism, but most people don't really practice that. They use it real loosely. But yeah, it's almost always systemic.
Yeah. I know a lot of like our assessments we do when a new client starts and we're checking movements, right? Their movement quality. It's almost like we can see someone come in their squat. I can tell based on someone's gait, how they walk or how they squat, if they have a seated job or if they're active to some extent. And I'm sure you get a lot of people who sit at desks that come in, their lower back's hurting. They want, treatment for.
Yep.
When I know in our conversations that overactive, underactive tissue, when you can correct that, then there's less issue to begin with.
That's right. Yeah, and with what you guys do with training your clients, I mean, imagine if everyone was compliant. They came in as much as you suggested to make the changes they made. They addressed these other factors. They addressed it in a holistic approach. The speed at which they would change would really be amazing, because that's really the only true way to transform someone but you got to start somewhere.
Mm-hmm.
You got to start somewhere. It's a stair step type of approach.
Yeah, and we want that for everybody.
Yeah.
Sometimes it's the best way to, like, you both mentioned it, is to get that ball rolling for them where they can see it. And then once they see something, they get hungry for more, right?
Yeah.
Sometimes it's just like, all right, what are your habits on a day-to-day? What's one small thing you can change? Just one.
Mm-hmm.
It could be
Yeah.
like, hey, let's substitute out that morning Starbucks coffee for water.
Or not even that. You can take it a step further. This is what I used to do. Is, let's say someone's grossly overweight, they're a smoker, and you're trying to get them to go from that to the gym. I mean, that's a pretty steep gradient for someone to do. So instead, I'll say, okay, when you get up in the morning, before you have your bowl of cereal and your coffee and your cig, just put on some gym clothes and just stand outside. Don't do anything. Just go stand outside. Have a drink of water. When you're done with that, go have your bowl of cereal, your smoke. And again, back to what I was saying, where I started, when you give your body what it needs, you stop craving the things you want. So have them to do the things they need first, and then see if their chemistry changes. Yeah, I mean, that's a way to get someone down the right gradient. Is don't tell them what not to do, just give them some advice on what to do first. Yeah.
Like elimination diets, like people will say, I can't eat this at all ever again, which it's not sustainable, right?
No, it's
so
not.
I can think, what's one food you'll never give up? Bacon?
No. I mean, eggs, chicken, probably eggs though. I mean,
but that's healthy, right?
Yeah,
What's one of those negative foods? Like for me, it's pizza. Pizza isn't super healthy. I love pizza. It's my go-to. And, frequency, like you said, you eat clean 6 days a week, and your metabolism supports you eating whatever you want one day.
Mm-hmm.
And I'll do the same thing where I'll go to the pizza buffet and just devour, So it's like eliminating that one thing someone likes. Like, I love ice cream. Okay. Someone said this to me. You love ice cream. How many times do you eat it in a week? Well, I have 3 scoops at 9:00 every night. And I'm like, let's cut that down to 1 week. Just once.
Yeah.
Once per week.
Yeah. And you look forward to it.
Yeah.
Mm-hmm.
Yeah. You talk about eggs. I'll give you another interesting thing about eggs. So like when balancing metabolism, most people eat eggs in the morning, but some people who are inflammatory, whatever, arthritic knees, bad back, however inflammation manifests, eggs are really high in arachidonic acid, which when people are inflamed, when do they usually feel the worst? In the morning, right? So those that have inflammatory conditions, we train them on, maybe you don't eat the eggs in the morning. Maybe you have them for lunch or for dinner, right? When that inflammation isn't at its peak in the morning, because we don't want to add fire to an inflammatory condition in the morning. A lot of arthritic people hurt in the morning. So no eggs in the morning. You can have it in the afternoon or the evening. Just an interesting thing with eggs and inflammatory.
What was the acid again?
Arachidonic acid.
Arachidonic.
Yeah.
I was thinking, when you said it, my brain's like Adirondack chair. That's how
Yes, I guess maybe the syllables are similar, yeah.
So, like, specifically, like meal timing, is there a best time to eat like protein, carbohydrates? Because I've done some research on it. And
Yeah. So again, it all depends on your objective, right? I mean, if your sole objective is to gain mass, that's different than balancing your metabolism. Let's face it, right?
Right,
I mean,
right.
to put on mass, you got to take in a ton of calories. You have to be in a surplus. So your question was timing on when to eat those things. So it's different for everyone. I'll just tell you that, or it can be different for each individual depending on the individual. But essentially, the rule of thumb, my rule of thumb, is your meals should be 5 hours apart. No snacking in between, and you don't eat past 9 p.m. if you can help it. Obviously, if you're a shift worker, we have to play with that. But and the reason is to let your body fast, right? You're basically fasting between breakfast and lunch for 5 hours, lunch and dinner for 5 hours, and then throughout the night. So your body can utilize that energy and absorb it, not store it, right?
I'm a huge believer in, no, it's not intermittent fasting, it's intermittent energy restriction. Because when you can, anybody who's dieted and they're in a deficit, that, I don't know if it's this way for you, but when I'm like in a deficit, my hunger builds from day to day, or I'm like,
Yeah.
I start smelling McDonald's and I'm like,
Yeah, you become famished.
yeah. So it's basically breaks in that diet where you go from deficit maintenance. That I found to be sustainable for myself, and had clients have great success with it. I think.
So you're talking about going into a deficit?
Yeah.
Yeah.
So like alternating deficit and maintenance, and typically, so the studies actually, the Matador, minimizing adaptive thermogenesis and deactivating obesity rebound. Long acronym.
Mouthful.
Yeah. But what that does, from what I've seen, is it preserves what we're talking about is the metabolic function. So you don't have that adaptive thermogenesis where, processing calories, the body slows. You don't have that same effect when you're going like this on a week-to-week basis.
It's these conversations we're having are good, but these are the conversations that really confuse consumers, right? Because you start getting in the weeds and they just, they bail. So simplicity is always good. What you're talking about, something that I have a lot of interest in is this, this 48-hour fasting to create autophagy.
Oh yeah, yeah.
Right. I think there's a lot to that. It's not for everybody, but periodically, whether it's, and it doesn't have to be long. They say around 48 hours for autophagy to occur, but for your body to start cannibalizing those bad cells, right? Just cleaning out your system. It's like cleaning your carburetor every so often.
No, this
I
is
think has amazing effects.
Just like a water fast.
Yeah, just water fast. Some suggest you can have black coffee or tea, but
You've done that before, haven't you?
Yeah.
I made it 36 hours, and that was like, I had something I had to do physically, and I'm like looking at it. It was like cutting wood or something, and I'm like,
But it's amazing, if you take yourself to ketosis, if you do that long enough, get yourself to ketosis, you have a short window where you just feel like you're Superman.
Oh yeah.
Your vision your acuity is just on point. I mean, you're ready to kill something, right? You're on a hunt.
I went
to fuel your
69 hours. I was going to do the 72, and then if I didn't eat at that 69 hours with what I had going on, it was going to be like 76 or something like that. So I ate then. But it was towards the end. We went to a Red Wings game, and there was some wings place, and all these guys went, and they're all mowing down. I'm sitting in this restaurant, got 4 guys around me all mowing down wings and
fries and
absolutely good. Go to the Red Wings game. The only time where I was like, man, I could eat was smelling the sauteed onions when we walked in through the concourse. And it was like 2 seconds where I'm like, damn, those smell good. But other than that, I was a rock. And I went another 30 hours, something like that.
Yeah, that's pretty impressive.
It's
just interesting to do. It's interesting to see what your body's capable of, And I mean, how many people have done that? How many people have not eaten for a day?
Right.
I mean, hardly anyone, right? Unless they're sick or something. But
And we're built for that.
yeah, of course we
Because
are.
times of, like basically every winter when we were hunter-gatherers, there was lack of food. So that's where everything I've researched is that ketosis you talked about, in that moment where there's that clarity and there's like, that's a survival mechanism for us to be able to go get food.
That's
with
right.
no energy.
Yeah.
So we produce that ketone bodies that fuel us. Yeah. It's super
But instead what
interesting.
we do is do the opposite. Now we have so much energy in our body or stored, fat that we're so far away from experiencing that feeling. And to me, that's what a balanced metabolism does. You feel like that the majority of the time.
Yeah. So when we're talking, client walks in, how do you differentiate when you're looking at an individual, like this is a mechanical issue or this is a metabolic issue?
The first question I always ask when I take a history of someone, and I know this, it's I really get into their metabolism first to see where they are. I mean, if they're loaded with medications, if they're diabetic, I know that that's going to be a factor.
Right.
So it just sets the prognosis up for me and for the patient. Obviously, if it's a super healthy individual, they're fit, they're active, and there's no complicating factors as far as metabolism goes, it's most likely a primary mechanical or structural issue. But
I'm sure you see them layered too, mechanical issues on the
for sure,
metabolic issues
yeah.
too.
And obviously, it's sometimes like I'll see patients that just have this huge transformation of weight, like they'll lose 100 pounds and they didn't have any pain when they're 100 pounds overweight, and then they lose all that weight. Now they have back pain, knee pain. Why? Because now their structure's different, right? They're carrying, their center of gravity is different. Their biomechanical load is different. So they always say, why do I hurt now? I lost all that weight and my back's killing me. Well, you got a new you now that you need to get in the gym and build some strength and some stability and some endurance. Yeah.
Yeah. Yeah, because I think you mentioned GLP-1s before. I know a bunch of people have taken them.
A lot of people on them, yeah.
And they've gotten them off other medications, which is awesome.
Yep.
But what I see for the population of people that they don't strength train while on these medications is that, and there's science that's backing this up, there's muscle wasting.
So I'll tell you this.
A lot.
And I always applaud any individual that is trying to better themselves. So I don't knock on anyone that's on, that goes that route. But one of the things to keep in mind, and this isn't my opinion, it's a fact, is that on average, 40% of the weight that's lost is healthy tissue. What's healthy tissue? Muscle and bone mass. Okay? Most people get off those types of medications after about 2 years. 70% of them gain their weight back. But what do they not gain back? The muscle and bone mass. That's a way to age yourself in a hurry. Yeah. So those that are on that stuff should really put a strong effort into making sure they're getting the right nutrients. Because what does that medication do? It suppresses your satiety, right? It makes you less hungry. Therefore, you're typically not getting enough nutrients. So even though they look better and they feel better, their metabolism is definitely not in check. If I were to do that stuff, I would definitely be on a mission to make sure that I give myself the proper nutrients, not just eat a low caloric intake.
Right. Well, I was just discussing this with an individual recently who's been on it for a while and has had great success. Their joints actually feel better. They're down a bunch of weight and they feel great. And so they're talking to me and they said, I think I'm gonna go off the medication I'm on. And I said, Make sure you talk to your doctor about it. I'm not a practitioner in any way to prescribe or advise you either way.
Sure.
But don't just go cold turkey without talking to your doctor, and look at your habits, what are surrounding. Have you changed your eating? Have you changed your exercise routine? Are you exercising as frequently as you'd like? I ask these questions just because if this individual goes off of the medication and they haven't changed any of the habits, they're going to be in the 70%.
Yeah. Yeah, absolutely. I mean, you think about there's exogenous and endogenous. Right? Exogenous is from when you get from the outside. Endogenous is what's in the inside. So any type, whether it's hormone replacement therapy, whether it's, our body produces GLP-1. It's a natural hormone in our body. So when we take these exogenous hormones and put them in our body, it's going to suppress our endogenous system. And if you do it long enough, it shuts it down.
Mm-hmm.
And, the overall consensus in the medical field is, when it, like HRT, not to go off on HRT, but you shouldn't, in my opinion, and the consensus of most the medical community, HRT isn't meant for age-related symptoms.
Right.
It's meant for a clinical diagnosis, less than 300 total testosterone, hypogonadism, meaning, if you want to be fertile and your testes aren't producing enough testosterone, but if you take that stuff, it shuts down your endogenous system. So what happens if that stuff isn't no longer available? What's your system going to do? I don't know.
Yeah.
Well, I do know.
No production.
No production, yeah. And then you're going to feel like a lump.
Yeah, whether it be the GLP-1 or the testosterone, it's going to be, there's going to be a period that's pretty rough for each individual.
So those that do it for age-related, I mean, they really need to do it in perpetuity.
Yeah,
or
they're
else
signing up for a
they're
lifetime.
signing up for a lifetime, yeah. So it's a commitment.
Yeah.
Yeah. And the same with GLP-1s as far as I'm concerned.
So let's shift gears back to patients. Can you, when someone comes in, can you tell a difference in both the structure and metabolic health of an individual that walks through the door that weight trains versus someone who doesn't?
100%. I mean, anything just from the texture of the tissue, right? A healthy individual that is metabolically balanced, that exercises, they have very distinct tissue texture. Like you can feel the muscle fibers, right? Someone that's metabolically challenged and deconditioned. I'll just use this analogy. Like unhealthy muscle feels like leather. There's no discernible fibers. It's just feels like a tire, right? It's just dense. Whereas a healthy individual, you can really palpate and feel the individual muscle fibers and the different crossing of the muscles, and we're able to palpate that. On someone that's metabolically challenged and deconditioned, not so much. Not saying you can't, but it's definitely a difference.
And then for the people who aren't trained, I mean, it doesn't take a lot to. I always tell people, what do you have time for? Because if you're not doing any strength training and you add 60 minutes to your week, that's a huge increase. You're gonna see substantial results. Yeah. If you're only training once a week and you add 2 more days, whatever it may be, like you don't have to start. I feel like people get overwhelmed by the fact that it's like I have to be in the gym for an hour and a half, 5 days a week, and it's
you don't have to obsess about exercise. You just have to be consistent with exercise. Back to your question about metabolic, patients with metabolic and structural. A lot of times I'll see a patient will come to see me, my range of motion, my neck isn't good. And I'll say, okay, relax. I'll take their head myself. I'll move it. It moves just fine. I ask them to do it and they can't, right? These people have a stability motor control dysfunction, meaning they're so deconditioned, their muscles don't know how to move their body. Right. And just a little activation is able to restore and it was never a joint problem.
More a nervous system issue.
Nervous system issue, not enough muscle activation, but that's just a testament of getting into the gym and moving can make a big difference. It's not always structural, and it's not always skeletal in nature, I guess is what I'm trying to say.
Yeah. Going back to the kind of the GLP-1s and just people who undereat in general, there's a term called sarcopenic obese, which from all of my understanding can actually be worse than the just being obese, because sarcopenic obese typically, maybe this individual comes in, they're significantly underweight, or maybe they're normal healthy weight, but significantly under with muscle mass. What that does is maybe they have 70% of what their age and gender should have in their legs. And now that impacts bone density, which impacts resilience as a whole. So I guess...
Do we call that skinny fat?
That's the mainstream terms, but the actual term sarcopenic obese. So these individuals, chronic undereating, they don't strength train. They don't do, there's not like a whole lot of activity. And these people are at risk for heart attacks.
They're just as sick as those that are morbidly obese.
So I guess what would you tell, if you had that type of individual come in, what would you tell them as far as like metabolically what they need to do?
Again, it just starts from a ground level assessment, have their blood work checked, get them, change their physiology first. Because when you change your physiology, they have the hormones secreting that they want to do more, right? They want to go to the gym. They just feel better. So they're intuitively, they're going to do more.
More energy, more.
Yeah.
And then all of what you're saying, that ties right into hormones. I mean,
hormones is a big one with metabolic balancing, because your liver, if you're not getting the right fats in, or a bad balance of fats, your liver can't produce those hormones, right? Your body, your endocrine system isn't producing those hormones. You need to have a balanced metabolism, and that's, if I were to go on HRT, I'd make damn sure that my metabolism is balanced before I did it, so I can optimize that. Right. I mean, just makes sense. But yeah, you can transform someone's hormone levels by balancing their metabolism. When people get HRT, your hormones should be tested via blood work in the morning a couple times, because if I tested your testosterone throughout the day and checked it 4 or 5 different times, we're going to get 4 or 5 different numbers, right? So you want to see what is there a consistency low number or a consistent high number, whatever we're looking to do. I'm not an endocrinologist. Obviously I don't prescribe that stuff, but I just think that people need to back up and really set their foundation right before they engage in that, because I just think it convolutes things when you just keep adding layers on. Yeah.
And I mean, once you dial in the nutrition, some of the time everything else balances out. I've seen clients come through the door with, overeating. They have overeating habits, where that gets into digestive hormones, ghrelin and leptin, which when those are dysfunctional, like ghrelin's just kicking up, which is telling you you're hungry all the time, and leptin doesn't kick in once you eat, so you just keep eating.
That's right.
So what you're saying, that stuff balances that stuff out too, right?
Absolutely. Yeah, the ghrelin, and just, that's the whole purpose of balancing metabolism, is people know what to eat and when to eat. We were talking about earlier about having a bite of protein first, right? Suppresses the ghrelin, right? Just knowing exactly specifically, everyone is different. This is why some people do great on a ketogenic diet, some people don't. We all have different metabolisms. So one size does not fit all.
And then you go into activity level and
Stress levels and You know, my dream someday is to get, it's a hard test to ask, but I think about these kids that have like ADHD and all that. Imagine if those kids' metabolism were balanced. Imagine if they're eating what they're supposed to eat, what that would do for them. All this Adderall and Ritalin and all these things that really, I hate seeing kids on. If they would just address it metabolically first and see where they land, I think it would have amazing results.
Yeah.
And the science proves it.
Yeah. Well, and I think in general, we're on the frontier. Like when we talk about the science of what we know about the human body, I feel like we know more about like outer space than we do because it's so complicated. Like, all the stuff we've been talking about, how he responds to eggs versus how I respond to eggs versus how you respond. What does that have to do with our existing metabolic health, hormone health, gut microbiome, like all of these things, and how do we know?
Yeah. Well, unfortunately, and I mean, this is probably a whole nother discussion, but I think we all know that, we've been misled for a lot, just decades and decades. And that has really confused the consumer, who to trust. And that's unfortunate, but that's where we are. Yep. So, but I think, like I said, we know what's certain. It's Whole Foods, 100% of the time, all the time. It never fails you.
Yep. If it grows on the earth,
it's
probably
that's right.
a healthier option.
If you look at the package and it has ingredients on it, it's probably not for you.
Right.
Right.
Well, thank you for coming on.
Pleasure.
We do need to get back in there.
Yeah, we'll have to have you back in here and do a deep dive on some of these.
Yeah,
we had
great
so many
stuff. I love
topics
it.
here.
Yeah.
So thank you for coming in.
Thanks for having me.
Thank you, everybody, for tuning in. If you made it to this point, you're one of my favorites because you watched the whole video. We appreciate you. Don't forget, like, subscribe, share.